I always love coming to this event and talking about FAS and FASDs and, thank you.
Yep.
Thank you. And as Chelsea and I were kicking around some ideas for this year, we were going to do, updates or maybe something on brief interventions and how to engage women. And then vital signs came out from the CDC and pretty much all hell broke loose. And what ended up happening was it raised awareness to a whole new level, but a whole different level of conversation in the country that I thought may be making your discussion a little bit more challenging because of the backlash and because of the misinterpretation and the headlines that didn't reflect the data that was released. So we were kicking around just thinking, why don't we tackle this head on and see how it could potentially affect what you do in engaging women to even have this discussion or to agree to be screened and provide you with some ammunition, which we have, to help make that discussion go a little bit easier. So I hope that's okay with you guys. Because the top 10, what's new in FAS, this really pretty much trumped that. Learning objectives, and I think you've probably seen these already in your evaluation tools. We're going to discuss the recent data on alcohol use, point out what's new, identify demographics for women at risk, because I think that is really key to the work that you're doing. And then we're going to talk about key talking points and how do you engage women and how do you kind of normalize the discussion, which always seems to be what we're hearing from physicians, is that's one of the barriers to talking with women is, I don't know really how to do that, especially in light of this conflicting information that seems to be going around the country. So what is some of the recent data on alcohol use? Most of this is it's recent, but not a lot has changed. For women nationally, at least those who have at least one drink in the past year is 49.9%. It's been hovering at 50% for the last how many years? So where we think it's like, wow, half the women drink, the cool thing that I always seem to forget is that 50% of women pretty much don't drink. That's a pretty high number. I'm always surprised at that. So of these drinkers, past year drinkers by number of drinks per drinking day, that doesn't mean that they're drinking this every single day, but when they reported how many drinking days they have in a week, this is pretty much in a day that they drink, how much they're drinking. So 48.2 just have that one drink that we would consider low risk. 29.9% have two drinks, and 21.9%, again, of the women who drink are reporting each time they consume an alcoholic beverage, they're having 3 or more drinks per occasion. And that's where we're kind of worried a little bit more about risky drinking. Monthly binge of 4+, 14.6% of women are telling us they drink that much, which is pretty much average. And this is the new December of 2015 National Institute on Alcohol Abuse and Alcoholism data that came out. In Wisconsin, the BRFIS data, Behavioral Risk Factor Surveillance System data, showed us that among women 18 to 44, 63.3% report drinking alcohol. So we're way higher than the national average. So fewer women are reporting no alcohol consumption. And 26.1% of those women report frequent or binge drinking. So just a reminder of more than 7 drinks in a week is risky drinking. More than 3 drinks, so 4 or more drink, is considered a binge. And we can find, we can wordsmith, is it on occasion, is it about a 2-hour period, but we're trying to get at, to constitute a binge, it's really what it takes to get you to 0.08. And that's what is usually for the average woman about, more than 3 drinks or 4 drinks or more in about a 2-hour period. It's about what it takes to get to that level of intoxication. Impairment certainly comes before that point. So the newest maps, and again, this BRFIS data is always 2 years delayed by the time it's analyzed and put in these maps. So you've probably seen this already today, but just really showing how we relate to other parts of the country. We used to always be number 1, and then when we went from number 1 and number 2, we were always fighting that status with Vermont of all places. But now, if we look, Minnesota has just eked over us, and North Dakota has eked over us by a whole point. And there's a cool statistic if you dig through the data that while we have more, let me get to this is any alcohol consumption. Here are binge drinkers. So we do pretty much lead the nation in the binge drinking category for women 18 to 44, which is considered the prime childbearing ages. So we kind of lead the nation in that, but even though Utah has fewer women who binge, of the women who binge in Utah, they drink higher than the Wisconsin women, which is kind of interesting. And we could think of all kinds of reasons why that may be a more hidden number and where more stigma might be attached to that in areas where there's more of a taboo for drinking, as opposed to Wisconsin, where it's kind of, you know, we all joke about our alcohol culture here, but it is a true fact. It's a phenomenon, I should say, that alcohol is more the norm here in Wisconsin than it is other places in the country. Alcohol health, again, just a reminder of all the things that alcohol can do to harm health. So looking at stomach or digestion, increased risk of cancer, and looking at, you know, with each additional drink a woman has, each one additional drink a woman has in a day increases her risk for breast cancer by 10%. So if you're drinking a lot on a routine basis, your risk goes sky high. And I'm still waiting for those pink ribbon campaigns that talk about annual mammograms, monthly self-exams, to also look at your alcohol consumption as one of the best ways to reduce your risk of breast cancer. Same with heart disease. Alcohol has become one of the leading factors in heart disease in women. And we don't hear a lot about that in the prevention campaigns. At least maybe it's just a local phenomenon here in Wisconsin, we don't hear about it. Weight, nutrition, it packs on a lot of calories, high blood pressure, compromised immune system, all of these down to the risk, of course, of what we're talking about is a risk of an alcohol-exposed pregnancy and an increase of risk of having a child with any of the fetal alcohol spectrum of disorders. So what are we looking at for alcohol in pregnancy? So these data came out from CDC in September of 2015, and I'm keeping the overall number as a reference point on top. Of any use, 10.2%, binge drinking, 3.1%. So women who are pregnant women who are 18 to 20, about 8% are drinking any alcohol, 4.3% are binge drinking. So these numbers aren't going to be cumulative going down. We're not going to be looking to find these adding to 100%. We're looking at the numbers going across. So of pregnant women who are 18 to 20%, this number stands alone. 21 to 24 years of age, 10%, 4.2%. 30 to 34 is 8.7, but look at 35 to 44, where we're kind of, you know, maybe women, especially 42, 43, 44, aren't expecting to be pregnant, is the highest any use during pregnancy, although not the highest binge. So numbers to keep in mind is we might be thinking about who really does need a screening. Pretty much everybody needs a screening. If we look at race and ethnicity, overall, again, I'm just keeping that reference in there. For white non-Hispanic, 9.3, black non-Hispanic, 13.9% of women. Hispanic women, 9.1, and that's pretty new phenomena over the past 5 years. Hispanic Latino women have caught up with Caucasian women in their drinking. When I first started out in the field, it was very, very low. It was like 1%, 2%, and it stayed that way for a very long time. And then we saw a phenomena as the longer a woman lived in this country, and they were kind of judging that by even English fluency, we were looking at rates coming up. And now the rates are pretty much matched Caucasian. Other non-Hispanic, 11%. And there are no estimates available for binge drinking. Isn't because there weren't enough women. It was interesting to read because the range was so broad that when we're looking at standard deviations, the data was uninterpretable because it went from the lowest to the highest. So the range was all over the place. Education level, again, there's that overall just as a comparison point. High school diploma or less is the least likely to drink when you're pregnant. College degree, the most likely to drink. And this is for physicians when we're working with, is the hardest point for them to get over, because physicians will tell us, but I would expect that they would know better. And typically the more educated, we're looking at fighting the data. And this doesn't apply to me, this doesn't apply to me, I'm getting good prenatal care, I think I can handle this, and I think I would feel it. And there's also this misconception that I can hold my alcohol. Well, just because you don't feel buzzed, and just because your brain has learned to handle the alcohol doesn't mean your blood alcohol concentration isn't at a level that can harm the developing fetus. So sometimes it's hard to sort that out and to get that message across. So sometimes when we're thinking about who's at risk, we have a different picture in our mind than the data supports. And then married and not married. So we're looking at more not married women are drinking. So we get the college-educated, Caucasian, not married women, 35 to 44. are the ones who we want to kind of look a little closer at. Although I think the numbers show that everybody is drinking. I mean, there's the risk category covers everybody. This one I found was really interesting, and I just want to read it because among binge drinkers, pregnant women report significantly higher frequency of binges than non-pregnant women. This is the fact that really surprised me. Pregnant women reported significantly higher frequency. They're binging more often than their non-pregnant counterparts. That's CDC, that's nationwide. So that's not even talking specifically about Wisconsin. So the work that you're doing with My Baby and Me is so important because we don't know who's going to be in this category. So then this year in February, Vital Signs was released by the CDC. For those of you familiar with vital signs, they come out very, very frequently. And for each individual vital signs, a team works on it for about a year. They collect the data, they go through the data, they figure out how to report the data in the most honest way, and then develop a media campaign around it so that the messages, the correct messages, based on the evidence, get out to the public. Long process, lots and lots of work. If you've ever worked with the federal government, knowing how it has to go through the Office of Management and Budget, OMB, that these things take a long time to get approval. The wordsmithing and the amount of versions of everything, any drafts that go through, it's really a timely, it takes so long and a lot of work goes into it. So it doesn't just come out like someone released a report and missed a typo. It still happens that they miss typos, but these are really well prepared. So when something happens like it happened this year that caught the CDC off guard, you knew it was kind of big news. So Vital Signs is released. New report showing 50% of pregnancies unplanned. Again, that data hasn't really changed much. Most women don't know they're pregnant until 4 to 6 weeks of pregnancy. Those of you who've had a child pretty much know that's true. That hasn't changed much. What was a big factor is 3.3 million women in the United States are at risk of an alcohol-exposed pregnancy. Those are women who are having vaginal intercourse with a man and not using effective contraception and drinking at a risk that we would be concerned about. Every single month, 3.3 million women are at risk of an alcohol-exposed pregnancy. That's what the data showed. 3 in 4 of women who are reporting wanting to get pregnant as soon as possible, they're actively trying to get pregnant, are still drinking alcohol. So in any one month, you can get pregnant. For everyone's individual cycle, we don't know how far along before you realize you are pregnant. From your initial training on fetal alcohol syndrome and fetal alcohol spectrum disorders, that is My Baby and Me sites I know you've had, shows that those facial features are formed in those first couple of weeks before a woman realizes she's pregnant. Brain's already forming, central nervous system is affected, heart's beating. So alcohol early on can have dramatic negative effects on the development of the fetus. So these two facts that were the new facts were pretty amazing. And then the media frenzy hit. So here's some of the things that we were reading. The CDC's incredibly condescending warning to young women. Does the Centers for Disease Control and Prevention know how pregnancy works? These were headlines. The Washington Post. Does the CDC know how pregnancy works? Yeah, I'm pretty sure they do. The CDC can rip the wine glass out of my childbearing aged hand. So somewhere along the line, one media source that I will not name put a headline out that did not follow the actual data that was released. It was to grab attention, to sell. Newspapers are more likely to get clicks on the web. Many of these pulled it from those headlines. So when we started getting calls, and we were getting calls, and Lindsay works with us, and he's like, we were getting calls, we were hearing the frustration with the CDC, and all I would say was, check the original source, here is the media kit, here are the fact sheets, and then call me back, please. Check the original source. If anyone's ever heard me speak before, you always hear me say, go to the original research. Don't go by the hype in the headlines, because usually they get it wrong, because they want to sell newspapers or get those clicks if they're chasing their web-based or website metrics. I am not less important than my potential future unborn fetuses. Grounded parents are saying, no, 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 I come first. Again, not looking at the data that they cited I couldn't find out where that actually came from. Backlash over CDC paternalism overshadows real risks of drinking in pregnancy. So though Forbes was saying, you guys screwed up, you didn't give a good message, but the real risks are important enough to talk about, so let's have that conversation. They go on to say they bungled it to such a degree that they very well might cause harm by obfuscating just what the risks are with their paternalistic decrees. So there's that word again that came up in one original headline, saying that women should consider this when they're thinking about thinking about using contraception or drinking if they're at risk of pregnancy. Not that they can't do it. All women of childbearing age should abstain from alcohol if they might become pregnant. It's getting a little bit closer. CDC sets off firestorm by warning women about alcohol. Because apparently, it's Today's Show, they set up a firestorm by warning women about alcohol. Okay. No alcohol for sexually active women without birth control, CDC recommends. Not quite. Not quite. There's an important, there's some important pieces that we're missing. I could have had 20 slides of those headlines, and I knew I was time limited and I had to think about what the priorities were, but it was pretty interesting that it was all over the board on what we would consider liberal media, what we'd consider conservative media, and what we'd consider middle of the road. Everyone picked up on it. So we had some interesting side effects. Some of the women that you're talking with when you bring up a screen or if they want to be part of a project before you send the information to the Women's Health Foundation is that they may be more defensive. They might be more defensive about the topic. They might have been reading this, watching the doctor's show, watching the news media. It actually went viral, which is pretty cool because FAS has not gone viral really ever because it's just so little known, but it did bring attention to it. But emotions are also running really high. And it's big brother, keep your hands off my body. So they might have, and they should have, very well, they should have more questions. Puts the burden on you then to have all those answers and to be able to explain the data and to identify what data is out there that's not accurate and provide them with the accurate data. And they might not want to participate because they might be feeling that paternalistic attitude and be untrusting about, well, where's this data actually going? Is this data now going into where the CDC is going to be reporting my stuff in the next 5 years? Which it's not. You can assure them of that. I mean, I assume it's not. So again, your discussions are going to can be potentially a little more challenging. But the real cool thing is that people were talking about it. It's died down. It always does. But for 2 weeks, people were talking about nothing but alcohol and pregnancy. I've been in this field for over 30 years. That has never happened before. So will I take the good with the bad? Yeah, at this point in my career, I think I will because something happened. And I think things are going to continue to happen. But what can you do? What tips and tools can I help you with to put it into perspective? First of all, I was invited to the press conference that provided everybody with the information. It provided everybody with talking points for the media and the actual facts. You guys are going to get that whole packet when you leave. So you have everything that the CDC wanted everybody to have. And the really interesting part about this was vital signs came out. I talked about how long it takes to make these changes typically, how long it takes to create a document. And within the week, the document was altered. We didn't catch it, Lindsay caught it. That some of the, how come this is all for women, how come there's no men on here? All of a sudden, we're clicking on this fact sheet and something's a little bit different. And they changed some of the images to include men in the conversation. So if anyone thinks that they weren't responsive, not only were they responsive, they responded immediately, which was really cool. So we're going to make sure everyone gets the entire press briefing kit before they go, so you can put it in your toolkit when you're talking with women. But I want to put this into a little bit of different perspective. How many of you have heard of Zika and pregnancy? Yeah, it's a pretty big deal. We're going to do some comparisons here, and this is where this is what the CDC knows about Zika. Can spread from a mother to her fetus during pregnancy. Infection with Zika during pregnancy may be linked to birth defects in babies. Not 100%. It may be linked. I'm not quite sure in what conditions it is and what conditions it isn't, and what women are safe and what women are safe. It's unknown if there is a safe time during pregnancy to travel in an area with Zika. Is any of this messaging sounding familiar? No safe time, no known safe amount. It's unknown how likely it is that if you are infected, your baby will have birth defects. February of 2016, this is becoming this is now the viral topic. It continues to be. Each new woman who contracts Zika who is pregnant. So then, within how long we had this international response? I want to know how things went through OMB. I don't know. World Health Organization got involved. The British ministry, they were sending out warnings within weeks of the big media outbreak. It wasn't even weeks, I think it was hours. That if a man travels to a country where there's Zika, he should come back and wear a condom. How much backlash do you think they got about that? Everyone's jumping on board, absolutely. Put the men there, have them, take the risk away from women. Have a man control whether they're exposed to Zika. No backlash at all. Actually, kudos to the Parliament for coming up with that. CDC has a response. National Institutes of Health has a response. Is this a new threat? No. It's been around for at least 10 years. Last spring, 1 million Brazilians were affected. I didn't hear much about that. Linked to increase in microcephaly in Brazil, 1 million affected. How many of us were reading about this last year? So indulge me in this little comparison. These come off of fact sheets that are available to anyone. Zika in pregnancy, spread from mother to fetus. Alcohol in pregnancy, transmitted from mother to fetus. Zika infection may be linked to birth defects. Alcohol in pregnancy exposure may lead to birth defects. Not 100% of the time. Zika, no known safe time to be infected. Alcohol in pregnancy, no known safe time to drink during pregnancy. Zika, unsure if infection will result in birth defects. Alcohol in pregnancy, unknown if alcohol exposure will result in birth defects in any one pregnancy. Why is there backlash about alcohol and recommendations to avoid pregnancy if you're drinking above recommended levels that have shown to be toxic to a pregnancy? Why is that the paternalistic approach and not about Zika? We've involved men, we've involved women in trying to avoid pregnancy when you're traveling to Zika areas, or if you're pregnant, not to travel to those areas. And yet, if you're pregnant and you're warned about the potential effects of alcohol on pregnancy, we start tossing terms about paternalism. And you can't control what I do. A week after this vital signs for alcohol was released, they released the next vital signs. It was 1 week or 2 weeks where they showed the national map, just like they do about the alcohol, about who's not getting adequate sleep. Wisconsin wasn't the worst state, but it was one of the highest hit states of basically no one in the country is getting the amount of sleep recommended for optimal health. Very few places were getting that. Wisconsin's in the second highest risk category, one down from the worst, which is better than the alcohol. And just for fun, I saw that on someone's Facebook page, and I just shot back, how dare the CDC tell me that I need to get sleep? Just for that, I'm going to stay awake for 3 days and let them. We're just goofing on them, not on CDC, but on the message of why do we take some things? What is it about alcohol that has this level of don't touch it, especially in our state, but certainly in the country, because this backlash was nationwide. It wasn't worldwide, interestingly. It was in our country. The European media they were pretty amused in some of the reports I read about why are they fighting this? What don't you understand about the original data? What did you misinterpret? But we kind of took it to a whole level of extreme. I don't know, but I have more. Zika in pregnancy, they have travel notices. For pregnant women and their male partners, recommend to follow strict steps to prevent mosquito bites. Pregnant women and their male partners, when they alluded to that in vital signs, pregnant women and their male partners, they had to change that to their partners because not all pregnant women have male partners. Some have female partners, some have partners at all. It never came up with Zika. Interesting. Consider not having sex. Could you imagine, consider not having sex if you're drinking? Or use condoms the right way. See a healthcare provider right away if pregnant and have symptoms. How often do we say, see a healthcare provider right away if you found out you're pregnant and you've been drinking? Alcohol and pregnancy, and this again is assuming that everyone has access to a healthcare provider. When we talk about alcohol and pregnancy, it comes up, not everyone has health insurance. It didn't come up with Zika. Alcohol and pregnancy, 40 plus years of awareness. And it took this last recommendation of vital signs to have it go viral. Recommend to avoid drinking during pregnancy, that's been there all along. But only during pregnancy. Nowhere did it say women 18 to 44 should not drink, which is what made one major news publication headlines. They didn't say that anywhere. Advice on accurate use of contraception. We can talk about condoms the right way. Everyone's like, thank you, show us the videos. We get here of what, you don't think I'm smart enough to figure out how to use my preferred method of contraception. Advice to cut down or quit drinking if pregnant. Vaginal intercourse with a man not using effective contraception. That's what the message was, and that's what was the hardest to take. The comparison to me is so striking. So I was glad when I was able to test out this talk here, see how it goes. So the talking points for vital signs, and again, you're going to get this whole press kit, is that 3.3 million women are at risk of exposing a baby to alcohol if they become pregnant because they're drinking and not using birth control. That's actually supported by the evidence based on, in the past 30 days, have you had vaginal intercourse with a man? Did you use contraception? Did you drink alcohol? So even if we think that maybe alcohol use or things are underreported, maybe we could consider that a conservative number, I don't know. Alcohol use during pregnancy can cause problems like preterm birth or miscarriage and FASDs that can permanently damage the brain and cause behavioral problems. It can, not that it must or it will in all circumstances, but it can. 3 in 4 women, 75%, who are actively trying to get pregnant as soon as possible were drinking alcohol. What if we heard that 3 in 4 women who are trying to get pregnant as soon as possible were seeking out vacation destinations where Zika is the highest? It would be so absurd. Why should non-pregnant women worry? Half of pregnancies are unplanned. There used to be a statistic that I actually haven't found lately that of those 50% that are unplanned or unintended, 50% are with women using contraception, not using it accurately, missing more than their number of pills and not backing up with a condom, not using a condom every single time. Most women don't know they're pregnant for 4 to 6 weeks. These are part of the kit, and women could be exposing their babies without knowing, so why take the chance? Or really flipping that and really just having a conversation of how much risk are you comfortable with? That's what it comes down to. How much risk are you comfortable with? So is CDC saying pregnant women should not drink? Yes, that's what they're saying. Pregnant women shouldn't be drinking alcohol because of the risk of fetal alcohol spectrum disorders. Just like they're saying pregnant women should do what they can to avoid getting bit by a mosquito. They support the positions of the Surgeon General, the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists. They didn't just come into this without any evidence to back it up. They're not saying that all women of childbearing potential should avoid alcohol. So what can health providers do? Ask about alcohol use. That's what you guys are all doing. That's what you're trying to do. Provide brief counseling or refer. You've got the benefit of being able to do either. Recommend women don't drink during pregnancy. or at least recommend that they have a conversation and think about the risk and what risk they're comfortable with. And that's what it really comes down to, is what you're comfortable with in everything you're doing. Driving a car without a seatbelt, riding a bike without a helmet, riding horses without a helmet, going roller skating without a helmet. In the last year, kids have died in all 3 of those incidents because they didn't have a helmet on. It's like, how much risk are we willing to take? And then we proceed forward with the full knowledge that everything we do in life has risk. We just happen to know numbers about some things better than we know numbers about other things. So the first one would be, as you're asking, as to before the questions even begin, just really define what you're talking about for alcohol. It's like a 5-ounce glass of wine. That's not really a lot. It's like a half-cup measuring cup you have in your house with a little bit more is a standard drink for wine. For hard liquor, it's the shot, whether you mix it or not. Have the conversation of what constitutes a drink and that they're all equal as far as the alcohol consumption. As far as the openness, the fact that they can say no initially and then change their story partway through is a good sign. That means you're building trust. That they came in a little bit wary, but 5 minutes later, they're disclosing to you what they had previously withheld, which means you pat yourself on the back. You're creating that kind of environment that's increasing trust. I used to hear, and for those of you who ever heard me do the screening and brief intervention talk, we've heard a lot from the field and from doctors that say, a woman comes in, I ask about their alcohol use, and whatever they tell me, I double or triple, because we know people underestimate it. And I always sit up and go, ooh, so basically you're calling all women liars. I don't like that. I think it's offensive to me as a woman. What I prefer to do is take ownership of that. If I feel that someone is underrepresenting what they're drinking or not being honest with me, I'm taking the blame for that I haven't created an environment of trust yet. Hopefully with the women you work with, it's not a one-shot deal. You're going to see them again, and you have time to build that relationship. You have time to build that trust. And even if you might think that they're drinking more, or even if you don't even think they're drinking more, but they have friends who might be pregnant too, you can still reiterate the message. Like, good for you. Because what we do know about FAS, as you might have heard in the news lately, is the leading cause of developmental disabilities, more prevalent than autism. And there's so many simple steps we can do to reduce that risk. So pats on the back. If you ever want to talk about it, if you have any friends who want to talk about it, you know where to find me. Build that trust would be my best advice to you. And the fact that you're seeing that change, reframe from, oh, she wasn't telling me the truth, to, wow, I'm doing something right. I've increased that trusting relationship. I'm going to keep this conversation going. So nice job. I think for some women too, that when they're talking with you in a clinic or whatever setting, there might be the fear of, now it's going to go into a file, someone can find it later. The fact that once the referral is made, there is no file to go into. The information is really secure, much secure. It's secure, it's confidential to a whole different level than sometimes a medical record can be, and that's the reality of the HMO system that we work in and live in. But yes, let them do all that work.
We'll take it off your hands.
Yeah, they're happy to take it off your hands. So anyway, I'll be out and back if anyone has any other questions, but I thank you for your time, and I hope this was useful.